Hey, this is Russ Fordyce again. I'm here with Naren. He is Director of Analytics with Counterpart Health, and he is one of our all-star judges on the awards program too. So, Naren, first of all, thank you for all your help over
Sure.
the couple of years now that we've been counting for scoring all those nominations. Why don't you give us a little bit of background about you and what you're doing?
Absolutely. Thanks for having me, Russ. And it's been a pleasure being a judge for BID. I've been in the healthcare industry for about close to 20 years now, working in various capacities, right from being a legacy software developer on mainframe platforms to a technology consultant and a business consultant for various large healthcare payers. But right now, I'm focused on analytics, and I'm the director of analytics at Counterpart Health. And my focus is more on risk adjustment, cost and quality analytics, and helping our customers get a better picture of patient health scores and patient health, population health at particular levels. So,
Yeah, I definitely want to get into the healthcare stuff because I'm personally interested in a lot of that and how we connect all that to data. And I think you are the guy to talk to about this.
sure.
But I don't want to run over your career because you've had kind of a big career spanning a bunch of different areas, bunch of different companies, a bunch of different kind of specialties. Walk us through how you kind of got into that aha moment into healthcare. How did you go like, oh, this is it?
So I joined as an IT, engineer for one of the companies where the project I got was for a large healthcare player in the US. That's where I started with my healthcare experience. And slowly, I think I got to understand healthcare data a little bit more as I worked through claims and adjudication and enrollment, membership benefit data, and so on. But claims was my area of expertise that I started out with. So that's how I got into healthcare. But really what drew me into analytics was I have always been an analytical person. It's just the brand of analytics was never part of it, right? Back then it was all mainframe technologies like DB2, and then we moved on to more modern technologies with the modern data warehouses. So I've seen the ecosystem evolve all the way from what we had back then to where we are right now with the cloud databases, right? So in the transformation of technology from legacy to the modern computing platforms, I have seen how healthcare companies have been adopting those technologies. They've always been wary of adopting new technologies given the highly regulated environment they operate in. But I have helped some of those companies do those technology transformations and help them with all their structuring of data and like, building the data pipelines and making sure that they get the right insights out of it. And that is how analytics came into being for my career.
Yeah, I think especially in healthcare, it's like you're unlocking this messy, complex data, but unlike a lot of data, the stakes of this data are your health.
Of course. Yeah.
and and so because it's health, you also have this compliance issue which you get to deal with. So you have spent a lot of your career with this explainable AI, which I want you to explain explainable AI to us because that's a new term to me. And you spent a lot of time with machine learning and healthcare data. And so I think I need a good explanation. I think the audience does of explainable AI. What is that? Now we're in this Gen AI world. And then also tell us kind of that difference of how AI and ML work together or how they're different.
Sure. So when we think about AI, it's all about predicting the future. All these LLMs, what you're getting is they just predict what the next word is, and that's how LLMs work. But to think about AI in the context of healthcare, you can do a lot of things with AI with healthcare. You can do workflows improvement, you can do disease predictions, you could do claims adjudication improvements and things like that. So whenever you take a use case like that within healthcare, and you're saying the AI predicts that this patient has this specific condition, why would a clinician trust that AI if they know better, right? It's even more important in an industry like healthcare because the stakes are, like you said, it's a patient's health.
Right.
unlike any other industry where the stakes would be either money or cost or revenue or whatever like that, right? So it's even more important for any company developing AI in healthcare to make sure that the AI is explainable. To say, no, I am predicting X percentage probability of a patient having this condition because of X, Y, and Z. So some of those conditions may be because I see similar patients across your patient population also having this condition, or because I see evidence in lab data or clinical data that points to evidence that the patient may have this condition. Things like that make the AI predictions more explainable, and it is absolutely important in an industry like healthcare to have explainable AI so that the people in the front line, like clinicians, the doctors, the nurses, they are able to trust the decisions that the AI helps them make. Otherwise, they're just going to say, I don't trust this, and the usage is going to just drop off.
So this is your proof. It's that here is what you should do, or here's the answer to your question, and then here's the proof and the backup and how I got to that proof.
Exactly. That's what explainable AI means, and it's paramount, absolutely, in healthcare.
Yeah, as we all use AI more, it is interesting because I do often go back and say, what are your sources for that? And can you give me a link to that so I can read that? And you'll see some different chat engines do different things and may give you the link to the source. But yeah, I understand what you mean is when you get into the actual intelligence of it, of what should you do based on, you know, historical data of patient data, you need to see either kind of be able to validate that patient data or that research or something else that the AI used. Just if nothing else, it's for trust.
Yeah, definitely. Back when ChatGPT came on the scene, there used to be so many hallucinations, as they call it, right? And whenever we see something that the AI proclaims to be true, we want to make sure that we question it. And back then, when we asked for links, you would be presented with links, but those links would not even work. They would hallucinate the links themselves too. They've gotten much better at it these days. You are able to see credible sources. We are able to see good citations for whatever we get back from the evidence these days. But I think that's also part of the explainable AI that we're talking about here.
Yeah. All right. So now you are also an ML expert, machine learning, and I have worked with a lot of machine learning people in the past. And so as it was emerging, as their thoughts and were emerging into AI, give us the elevator pitch on the difference of ML and AI or how they cooperate.
So they are, in a sense, they are interchangeably used within the industry. So back when predictions using data started out, it used to be called machine learning. So this was when you had these statistical techniques for making predictions, right? Like all of AI and ML is just making predictions with a certain level of confidence. So you would have these, statistical and legacy techniques of predictions, and that's what we used to call machine learning. And then we started getting more sophisticated techniques like neural networks, and that is when the term called AI came onto the scene. So if you ask any person within this industry, like, what's the difference between AI and ML? They are interchangeably used, and ultimately they are techniques for predicting something that is not known at this point, either at a future point or something that is bound to happen, or what
Knowable.
probability of that, right? Based on past data. That's basically what it all means. The techniques that you actually use to do that may be different, and that is what tends to be termed as AI or ML. The way I see it, I don't see a lot of difference as long as you're using the right techniques with the right data. I think that's what really matters. The term that we use to describe it, I don't think it really matters.
Yeah, I'm just thinking about it. I mean, you've got this kind of Wild West AI ML world going on right now, and you've got the most protected content, or what hopefully is the most protected content in the world, which is our healthcare data. How do you balance that kind of fine line fence of driving innovation while staying compliant? I mean, you can't just upload everybody's records to Chat GPT. So
Absolutely.
how do you strike that balance?
I think there are guardrails that have been put in place by the regulating entities. So typically what you would want to do is before sharing any data between entities, you sign something called a business associate agreement, BAA, which is what protects the data privacy and security of the data exchange between those two entities. But having said that, I also want to make sure that whoever's trying to implement AI in healthcare, beyond just the use case, beyond just the features that you want to implement, if you are not compliant, you would not go anywhere with your features or the use case. Design for compliance. I always say you would want to, like, even if you have the best use case in mind, it's going to be absolute jackpot, and it's going to integrate all of the different data sources. Make sure that you figure out the compliance part, have a partner that knows the legalities and the ins and outs of the regulations that are prevalent in the healthcare industry before you start rolling out any features. Because I know many enterprises, many companies who have tried to, go that route, and they have not been successful that way, right? So
Yeah.
make sure compliance is the first thing that you think about. And then once that's figured out, you can have that ecosystem which is protected. You can just go wild in that ecosystem. So just
Yeah, it's interesting you say that because I think we've seen some trials of that in healthcare of people who have kind of trying to break compliance. I mean,
right.
the whole Elizabeth, what was her name with the blood, rings a bell, kind of breaking the rules there or trying to break some rules. And I think we saw it when transportation with Uber, right? They definitely were not taxi commission compliant in any city they went to, but somehow they were able to push through that because it changed the industry and it changed it forced the culture to change because the compliance it wasn't up to date, you know. And I'm wondering, what do you are there any areas of healthcare where that compliance standard is maybe a little out of date or needs a little updating, and we need to push the boundaries a little bit more?
Maybe, but like I think that the downside of that is the data that you end up sharing is really, really personal data about patients, right? And I want to take that into context when we're thinking about innovation versus regulation battle there. You're thinking about, say, okay, user location data versus user health data. They're not the same, right? You're talking about privacy, data privacy. Yes, it's important, but it's just even more important when we're talking about healthcare data. And that is why I think that those industries may not be the same. And the meter of where you have to like gauge innovation versus regulation is different for different industries. And it's ultimately important for healthcare. And that's also one of the reasons you would probably see healthcare organizations being sort of some of the last ones to adopt new technologies because they absolutely want to keep compliance front and center.
Well, and that's what I mean is, it's I'm not suggesting that they'd take the Uber model and break through, but there are, I'm sure, these areas of the market, of the healthcare market, that are constrained for a regulatory reason or a compliance reason or a rule or something. And I'm just wondering, we've seen a lot of change in healthcare with the new administration. They're going after some pretty big tent poles, good or bad, whether you like it or not. It's changing. So I'm wondering if there's not an opportunity in kind of your domain where that boundary should be pushed. Maybe we should change something. I'll let you answer, I swear. I do remember the first time I think one of the DNA companies or something shared a little bit of data. Within a week, they had names and addresses of the people of the data that they anonymized, right?
Right.
So it's never anonymous enough. And I get that. But I am wondering if there are areas of the market that are constrained by this compliance issue where it just needs to be updated.
There definitely are areas where the innovation is definitely constrained by regulation, I would say. But I don't think the market is taking that as a signal that we should not innovate. Like you do see, like, for example, take scribing. When I say scribing, what I mean is like at the doctor's point of care, there are many companies today that offer scribing services where you don't have to note down everything in the conversation. You can just talk to your patient and everything gets recorded and useful information gets extracted out of that text, right? So what I'm saying is, even though it's highly regulated, you still see a lot of innovation that's happening. And you can imagine how personal that conversation can be. A conversation between a doctor and a patient is one of the most personal conversations that can happen within healthcare. And if there's very high competition within that space, you can imagine how much innovation is happening elsewhere. So even though it's highly regulated, I don't know that we need to push the boundaries because there's already so much innovation happening. There's so much competition that's happening.
Good. Well, it is certainly a market, and there's certainly a lot of players looking to improve that market. And I think if you talk to any AI specialist, I think healthcare is probably one of the areas, probably the largest vertical where they see the most impact of AI, just in general, is in healthcare in general.
Yeah, and I think it's accelerated in the past few years more than some of the other industries where AI was very readily adopted. Um, Healthcare was slow to adopt, but once we figured out the pathways, I think it's good going.
Yeah, and I think that the interesting thing I'm learning, I think others are learning, is that a lot of the healthcare thinking that we have is out of date, and there's newer information available, and it's literally just getting that newer information into textbooks, into doctors' hands, and into practitioners' hands. It's some of the hardest things to do is just communication, and it
Absolutely.
takes decades to get new information down. And with AI, if you can now ask it a question about, I don't know, something that just changed, right? There's a new result of a study,
Yeah.
then it's instant, and it's not this textbook business anymore, right?
Yeah, you have you heard of open evidence, where it's a very highly used service by clinicians where people ask questions like clinical medical questions and they get answers. And what it is powered by is like tons and tons of medical text, and it's the repository is actually like actively growing as new studies get published, new papers get published, which adds to the knowledge base. And like, if you're a doctor, if you're a physician, you don't have to like keep abreast of every single thing that gets published. But it used to be the case, but not anymore because you can just ask open evidence any question and you'll be instantly get the.
Well, and what's interesting, and I think you've written on this too, is if you can start connecting that with real world data on you, we're now at this intersection where I think it starts to get a little more interesting. So explain kind of that intersection. I know you worked a little bit on real world data, or a lot.
Right. So if you're thinking about general medical knowledge and then using that to connect with personal data, that's the basic super intelligence that everyone's talking about here, which is like, can you build a company around building a personal super intelligence where it's not just your health data, it's all of the data about one single person, and then using that to predict the actions, the conditions, and the state of health of a certain patient or a member. I don't think we are quite there yet because there's a lot of firewalls between the different silos of data that exist today. I'm not sure if we will get to a place where the data exchange happens freely across all of those silos anytime soon. I think it's all going to be protected by the entity that owns that data. Like, for example, if you're thinking about patient data today, it needs a patient's approval and consent to share that data with other entities. That's going to be the case everywhere too.
Well, yeah, I'd like to unlock. I see a world where we can unlock that a little bit, and kind of like the web world,
Yeah.
where we can plug into different services. Right, my website plugs into my email plugs into my text plug into my calendar. Where all of that's integrated, it would be nice to be able to plug in my healthcare data and say, hey, here's the world's greatest blood lab in the world. Let's run their AI on my latest blood work. Let me give them access to that blood work. Do we see any hope of getting to that level? I know so many companies, Microsoft being, I think, one of the biggest, have failed to kind of build those health portals that allow us to do that. You see any hope for that in the next 5 years?
In the next 5 years, I don't think there will be like a one single entity that like winner takes all that ends up in the winner takes all position. I think there will be multiple players vying for doing that sort of a super intelligence. I think the ones that are best positioned are some of these super aggregators, Google and Meta and Microsoft. They're in the best position to do it, I think, but it just takes a lot of resources to collate all of that and make sure that we have all of the compliance structures in place to get the data together in one place and then give the right view for the consumer. You don't want to like just present all of the data together. That's also part of what we do in analytics. We have to figure out what is the best view that makes sense for the consumer based on what they're looking for. I don't know that we're going to get there in the next 5 years. I think it may take a little bit more than that.
I always seem to be aggressive on my timelines. I envision all these connected systems in my head. I'm a marketing guy by heart, so it's, I'm envisioning this custom AI email marketing machine of, hey, I've got this data and that data. Let's put it together, and now we go. And I see it for the healthcare world too, of kind of like I said. So, I think it's there. It's just how do you get there with compliance and I think again with that explainable AI that you mentioned before, you've got to be able to translate the results or the knowledge that the AI is giving you based on the context of the user, right? I'm maybe a little bit more knowledgeable about certain medical topics, but other topics I have no knowledge about. And people are different. So the context of that is different, especially when you get down to that explainable piece. So do you think that explainable piece matters most for practitioners or regulators or consumers or
More for
somebody else?
practitioners, definitely for practitioners, I would say, because that's where we have to win the battle of trust. A well-certified practitioner who's got years and years of experience is never going to trust an AI prediction right out of the bat, right? So it's going to take a lot for any entity building AI in healthcare to convince practitioners to use their tool uh, and make sure that we present the right evidence, present the right context for the practitioner to understand why a prediction was made and to validate that to say, yes, I agree with this, or no, I do not agree with this. It's okay to not agree with it, but even in those cases, you still have to present the evidence and let the physician make that decision.
Yeah, it's interesting. It's almost like being a product manager. You're pitching an idea, and ultimately, that practitioner is going like, maybe
Maybe,
look at
yeah.
this. Maybe look at this a little different. Maybe I have a little knowledge you didn't think about because the AIs never seem to encompass all angles, or at least all angles that I'm thinking about.
Yeah. So if you look at the entities in the healthcare ecosystem, you have the insurance companies who are the payers and then the practitioners who are the providers. They all see patient data, but they see different sides of the coin. So as a provider, I see all of the clinical data. I see all of the lab data. I see the medical notes and the medical history, everything, right? So that's where the patient, like direct patient interaction happens. And then my billing team or my coding team fills out a claim and then sends it off to the insurance company. The insurance company only sees what's on the claim. They do not get the full picture. They look at what are the diagnosis codes, procedure codes, what was the amount requested, and things like that. But they do have other information like underwriting data, benefits data, enrollment data about the member. So the patient ends up giving different sets of data to the insurance company and the providers and the doctors. So getting a complete picture of a patient for any health tech company requires you to integrate with all of the different entities that have data about this patient. So you have to have integrations with the payers, integrations with the providers, integrations with the health information exchanges where that information gets transmitted. And the more integrations you have, the higher your strength of data retrieval will be, and the better you will be at capturing the true state of the patient's health. That makes sense? So that's what's going to drive the confidence and the strength of the evidences that you present for your explainable AI.
Do you see the barriers between kind of the providers and patients moving at all? Like, I guess yeah.
We have definitely come a long way. I don't want to get into the technicalities of it, but there is a lot of work that is being done around improving data transparency, especially within healthcare, how standardized the data should be when data is transmitted between entities. You can read a lot about TEFCA and QHIN, and that will give you a lot of information about background around the work that is being done, both from a regulatory and the government perspective on improving the state of healthcare data transmissions. So we've definitely come a long way.
Yeah,
And
give me a link and we'll include that in the follow-ups so that we can guide everybody on that because I'll definitely take a look into that. There's lots of similar constructs and the data protections on the web analytics and all the website and data protections on everything cloud. So kind of moving off topic, you've been doing this for a while. You've had this interesting career across, analytics and AI and healthcare and other domains. Um, what do you see kind of on the horizon in this space that's going to really kind of move the needle in the next 10 years, especially in the analytics piece of it?
The way that I'm seeing the industry move with AI and scribing and copilots, I think that's where the real opportunity is. I think the true winners in this arena will be the ones who are able to provide um, experiences for both the patients and the physicians um, that makes their life easier, right? And AI is going to play a big part of it. Like if you have a patient coming in, and if you have your EHR or whatever interface you have to interact with the patient's data, surface the information that is relevant at that point of time, at the point of visit. I think that's going to be very important, and that's going to become more and more intelligent as time passes on. Like 5 years from now, I don't think doctors would be looking for any information in the EHR. All of the relevant information is going to be surfaced to them. Patient comes in, okay, they know why they're coming in, they know the history of the patient already, and it's going to be very easy for them to decide what the care plan should be for whatever illness or whatever problem they are visiting a doctor for. I think that's where the industry is moving towards, to say surface the most relevant, most contextual information to the most useful stakeholders at that point. That's that's where the real opportunity is, and that's going to be way better as we get to a point where we collate all of the data sources from every single network about this patient, and then we present that data to a provider. So that's what everyone wants to do, but it's not so easy, and it's what everyone is trying to do that.
So now in your world, I know you build a lot of MVPs, the kind of minimum viable products, and I could see a lot of kind of MVPs in this space coming down of, hey, I want to try this. Let me try this interface. Let me try this view, this data stream. How do you decide when one of those releases is good enough? Like, how do you take an idea and try it out and then process it through your systems to when it's good enough?
I think from an analytics standpoint, what I've actually done over all of my experiences, when we work with product and we work with the PMs on certain features that are being released, and there's an MVP that's going out. The way to assess the effectiveness of an MVP is lay out the objectives of the MVP first. Say, this is what I want to see the MVP do. And these are the success criteria to decide how we move from MVP to full product, right? Full feature. So once you have those set up, then you should be able to measure data around your MVP, whether it's user engagement, whether it's user satisfaction, or whatever other objectives that you may set out. I think that data rigor is absolutely essential to make that decision of whether this MVP, because a lot of product organizations that I've seen before in our clients, they just roll out the MVP without any data instrumentation behind it, right? I think that's absolutely the wrong thing to do. It's analytics is always an afterthought, and I would urge every product person out there to not treat analytics as an afterthought. It should be absolutely integrated within your product lifecycle.
Yeah, having been online for all these years, I mean, analytics drives everything we do, right? It's move that button. Well, what if I do? What it's going to do to my analytics, right?
Right.
And
Yeah.
so you do the same in healthcare. I can't imagine the outcomes. It's if I'm doing this, I lower the blood pressure. It might do this and that and the other thing. It's you get into a whole different world of complexity and cost to a human, right? The risk. So when you're knee deep in this data and all these data streams, how do you keep everybody kind of motivated and going in your team?
So if you're experienced enough, so it really depends on what's your level of experience with healthcare data in the first place, right? If you're working with data analysts and data engineers, if someone's new to your team, it's your responsibility as a team leader to, number one, help them understand healthcare data, make them be comfortable if they have no experience at all, and build them up to a place where they feel comfortable with it and they are able to start owning responsibilities. And you have to be their mentor all the way through. But if they are if they are experienced enough to know their way around healthcare data, oh, I know what a claim looks like. I know what a membership enrollment looks like. What the eligibility data looks like. I think you want to still be a mentor, and like, I believe in giving them just enough responsibility more than they think they can do, so that they realize I'm able to realize my fuller potential here. Give them more complexity, more ownership. That's how I build teams. So if someone is like overwhelmed with healthcare data, I think it's just a matter of helping them understand that, hey, this is how healthcare data works, and this is not going to be extremely complicated once you understand the nuances around it.
Yeah, let's help you organize and understand it, and then
Correct.
pull
As
them
a
out.
leader, that's what I've always tried to do.
So on your team and yourself, you've got a lot of voices there. And outside of healthcare, I guess, what is your team talking about in terms of AI trends, and what are you excited about in terms of AI trends outside of healthcare? What's the team talking about?
I have a lot of friends and family and colleagues who I talk AI with regularly. We try to keep up to date on everything that's happening. Number one in the LLM world, which is like what are the latest models? Well, like what are their performances, and we keep track of that. And number two, like not just LLMs, like the AI products that are based out of LLMs. I think we also keep track of those and like figure out if we can make use of some of those tools in our daily life. And I strongly believe that anybody in the tech world that is not leveraging AI in their daily life is going to fall behind. It's become an absolute necessity at this point. You should be living under a rock if you have not started using some of these tools, not just occasionally going to chatgpt.com or like Gemini. And what I mean is like use them, like integrate those tools in your daily workflow, right? If you're not doing that, I think you're missing out. You definitely should. Whether it be someone who is like coding all day, or someone who is working with spreadsheets as a data analyst, or just PowerPoints as a marketing person, any tool that you work with now has AI. So make use of AI any which way.
I love there was one I used to love personally that was like it was my favorite, that just automated stuff, right? It was called If This Then That.
Yeah, yeah.
IFTTT.com.
Absolutely.
They're
Yeah.
still around, and they didn't have AI. I'm sure they do now, but and another one, Zapier, that I use quite a bit for the business. But it was always fun because you got to automate things, and now that you have an AI engine on top of that, it gets really interesting, right? It's like, hey, if you're bad at forgetting holidays or birthdays or something, well, these things can help you with that now, and
Definitely, yes.
and like you said, you just need to work them into your workflow.
I definitely feel that your productivity goes up manifold once you integrate AI into your workflow. And that's the difference between integrating AI into your workflow and just going to ChatGPT and asking questions. I think there's a huge difference there.
Yeah, now one area I'm gonna segue into a fun area of awards and your role as a judge. One area we've decided to be very human on is judging. We've gone to great efforts to make sure that judges aren't using AI and scoring nominations. That's not what we're about. We're about human content and humans reviewing human work. What makes a nomination stand out to you when you're reviewing them? What's really kind of when you see that all-star nomination, you give it all nines or whatever you do, what makes something stand out?
I think beyond the product or the service or the solution being really unique in industry, what makes it really stand out to me is quantifiable outcomes and measures that demonstrate that something has actually had measurable impact in the world, right? Anybody can just create a nomination saying, hey, we have this proposed solution that we are going to roll out. But if it is just a potential solution, or if it's just a service on paper and it does not have measurable outcomes, I think that doesn't really sit well with me. I think that what I'm really looking for when I'm judging is measurable outcomes, impact.
Yeah, we hear that a lot. I'm not surprised from an analytics guy that I get that either.
Outcomes
All right.
focus, and that's what I am.
It's in our DNA, right? We have a little quick fire round for you where we ask you a couple of different questions. First thing off the top of your head, favorite analytics tool in your stack?
More analytics right now.
Mode analytics. All right. Book or resource that shaped your thinking?
Power of habit.
Power of Habit. We'll add a link in the show notes too. And a data set that you wish you had access to?
Man, there's so much. I wish I had access to all payer claims database. There's a lot that you could.
Ooh, that would be a good one, right? It would tell you what's wrong with the world, right? Any one given snapshot of time. That would be a good one. All right, one final one. If you weren't working with data in healthcare, what surprising field would you be in?
I don't know, maybe a physicist.
Wow. Okay. You're reaching. I put physicists pretty much at the top of the chain,
As
top of the brain chain.
long as you're fantasizing, why not?
Yeah, the ones that I've met that I've had classes with or talked to, you sit down within like 10 minutes, you're like, different level. So I applaud you there. Well, thank you, Naren. It's been a really great conversation catching up with you. And thank you so much for your help all these years with the judging. And we look forward to you judging more.
Absolutely, it's been a pleasure. Thank you, Russ. Thanks for having me. Appreciate it. Have a good day.